welcome to Health Live at Seniors Today. We have here with us Dr. Aditya Agrawal. There's a special reason why we have Dr. Agrawal here. What you saw just now was the June 15th issue of Seniors Today magazine. And Dr. Agrawal has written the cover story in the magazine. And the magazine title is The Second Shockwave. Yeah. And I'm going to ask our producer to show the cover of the magazine. Yeah, so this is the cover story that we have, and where we're talking about the second wave of COVID-19, while leaving us reeling, has also renewed our commitment towards health and urged us to value our lives more than ever before. And it's an interesting story, one of a very easy read, even though it's about a very tough issue that he has written about. And we are going to be speaking with him about it, take his views, on the story, and also get you to speak with him and ask him questions on the magazine, on the article that he's written, as well as on the life in general, on health conditions, etc. So welcome to Health Live at Seniors Today once again, Dr. Agrawal. Now, to those of you, Dr. Agrawal has been there with us a few times on Health Live. He is a leading consulting pulmonologist attached to several large hospitals in Mumbai. He's extensively trained in respiratory diseases, both in India and New York. And as I mentioned, he has written the cover story in this issue of Seniors Today. So, very well written, Dr. Agrawal, your cover story. You are going to soon get us journalists out of jobs.
I believe so. Let's do that. And you can take my job. I'll be more than glad.
I could never ever do your job. So your thoughts on the article as you wrote the article, the point was to write about the second wave, and but could you just paraphrase? Could you just put the essence of the article in a few words? Obviously, you mentioned about the fact that the second wave hit us, took us all by surprise, and we were not ready for it, and it meant a lot of damage to a large number of families and all of that. But your thoughts on the second wave as we see it tapering right now in India?
When I was writing this article, the emotions were raw. It was so difficult writing this because you were going back to all those memories which you collected during the first and the second wave. As a doctor, we saw human tragedy firsthand. We saw how this pandemic panned out and how we were not so ready medically or otherwise to manage the pandemic. We were not ready to manage the sheer numbers of patients that we were seeing. We were not ready to understand, or rather, collectively work at this point in time. We could work individually, but not collectively. And that was the biggest challenge. The challenge was, how do you get everybody to, accept norms, correct diagnosis, the correct clinical treatment options, etc. So those were the challenges initially. But, as we went along, a lot of doctors did come along with us and understand that treating COVID was not necessarily something which required a lot of medicines, a lot of pharmaceutical agents, but it required a lot of common sense. Now, to put things into perspective, coronavirus is just a normal virus, and most viral illnesses are actually self-limiting. That means patients get better by themselves, but at the same time, we have to keep a close watch for certain patients who fall through the gaps. And these patients are the ones who have symptoms of mild, moderate, or severe COVID. A majority of our patients usually have very mild disease, which does not require any pharmaceutical therapy. Now, what happened here in the second wave was that we went the the spread or the increase in numbers was exponential, so much so that we all got overwhelmed with the sheer number of patients. We could sense, while treating patients from across the country, most of our patients were very severely ill with no beds in the hospitals. Now we know for a fact that there were several hospitals where there were lobbies running. There was a lot of corruption happening. We know that there were several patients who got beds while others, more needy patients, did not get beds. What we didn't see was a collective um, effort which involved a central agency. And also this has to be because we have a great amount of distrust with our government and anything which is regulated. Now, to come to understand, we had the BMC hotlines in Bombay running, but very often we did not find beds. And there is a certain amount of class bias which we see in our country. Patients who can afford anything or something all want to be treated in a private hospital, the largest if possible, with the best of amenities, and I don't fault them for that.
As we know that, Dr. Agrawal has finally been able to take a break from his very punishing schedule, and I guess we will just allow him this, you know, indulge in.
I apologize for that.
I understand. I have spoken with you. We have spoken with you so many times, and you are always so very busy. The very fact that you have been able to take this break speaks a lot for the situation in the country.
I'll tell you the reason why I've taken this break. It's a year and a half since I've taken a break. Otherwise, I was working those 20 hours plus every day.
Yeah, so you were talking about the situation, and all right.
I'm missing my son growing up. So sorry, apologies for that.
I think,
actually all doctors are humans.
Absolutely, and it's a very good sign. As I said, it's a very heartening sign, because I have always seen you, even while you're talking to us, you, one eye is on your phone because there could be some messages, some urgent calls or whatever. And the very fact that you have been able to take a break, I think it's, even if it's just for a weekend, is very heartening. It talks about the fact that, well, yes, the second wave has eased and there is less pressure on a frontline doctor like yourself. Is that a correct assessment, Dr.
No, the reason why I've taken this break is because I'm sensing increasing numbers of patients in the next 1 month. Again, because I had my own family members affected, and we had to administer certain new medicines which are available, like the Regeneron, which had just been launched by a company in India. And this is the same drug which a cocktail of monoclonal antibodies which President Trump was given. It helps patients in the mild and moderate diseases, prevents hospitalization, and it has worked relatively very well for my relative who has had a history of cancer in the recent past, has had chemotherapy and radiation. So obviously there's a lot of things happening even now which can be remotely. So when we speak about the second wave, what really went wrong was the fact that because of the sheer number of patients, there weren't many qualified people or healthcare professionals managing the patients. In the first wave, everything was rather controlled. It was controlled because what happened then was there were enough hospital beds available. The doctor-patient ratios were better. Unlike now, when the number of cases increased about 4.5 times. And to make matters worse, our Indian patients have very poor health literacy, which means that their overall knowledge of healthcare is very patchy or poor. And this has to do with the fact that we have never been taught about what good health is, starting from school. Um, a lot of our patients were deriving knowledge from WhatsApp, and I wish they did not. Even today, I did a session some time ago with a very large IT company, probably the number one in our country, where patients or people ask me questions such as, could I have CARDA? Could I do steam inhalation? Will that help me against COVID? Will that build up my immunity? Now, I did expect the educated patients to, or rather engineers to understand that, you do not do all such things. But those questions still came by. It just means that what we understand about health is extremely poor, extremely poor. So now again, with this media, we can actually, put forth the facts that, steam inhalation, CARDA, and all these homemade remedies don't really help. They actually worsen the symptoms of COVID. Now, when we speak about COVID, the most important thing is symptoms, managing symptoms and fever. So usually what happens is patients tend to ignore their fever, though it may be mild. It may be just a fever of temperature of 99 degrees Fahrenheit, but it is enough to, isolate yourself. It should prompt you to isolate yourself, quarantine yourself, and while you're doing so, test yourself. The minute you do that, you actually prevent the spread of infection. Now, each person spreads infection to several other patients. So, several other people who are not infected until then. So, this number actually compounds itself to increase. And what happens is you have a whole society full of COVID positive patients. Now, if we can stop this at source, instead of one becoming two and two becoming four and four becoming eight, eight becoming 16, and so on and so forth, if we stop or isolate the patient at stage one or that first patient, we will prevent the whole country from having the infection. Now, what really happened and what really changed between the first and the second wave was the um, frustration amongst people of the country with the lockdown.
Right.
And our government of India had done a fantastic job. I would actually like to commend them for doing what they did in the first wave. They kept everybody indoors. They engaged people by asking them to be indoors. There was a lot of CSR activities happening from different companies, which actually did not happen as much in the second wave. What happened was we became complacent. After the end of the first wave, we thought that, we have really beaten the virus and we're never going to get it again. But let me reassure you, until we have a herd immunity, which means that we have immunized at least 70 to 80% of our country, we are going to have wave after wave, wave after wave. It's not going to end at second, third, or fourth wave unless we vaccinate our patient, unless we vaccinate our country. So the most important thing today is to vaccinate. So if you are lucky enough to have got the vaccine or an appointment for a vaccine, do not waste it. Now, if you have had the infection in the recent past, it is imperative that you wait for at least 3 months before the next vaccination, because your body has sufficient antibodies against the virus, and it could this antibody, this vaccine would do better for somebody who has not had the vaccine. The government actually pushed the spacing between the two vaccines to 4 weeks initially, just to expedite vaccination of the healthcare workers and the essential workers. I feel for them. I understand that why they may have done that, but the best time between, or rather the best spacing between the two doses of the Covishield vaccine, which is the AstraZeneca vaccine or the Oxford vaccine, is actually 12 weeks.
Right.
So a lot of people came back and asked me, is the government delaying the vaccination, or rather spacing the two vaccine doses 12 weeks apart because we don't have the vaccine? No, that's not the case. We may have had the vaccine, but then we had to vaccinate more and more people.
Right. Okay. Doctor, you just mentioned about the fact that, and a scary bit that you mentioned was that in the next month, you expect the cases to rise. Why do you say that?
Once the lockdown opened in the last 1 month, we are seeing a steady increase in number of patients. We are seeing a few trickle of patients coming in, and there is a lot of hesitancy to mask up to maintain COVID appropriate behavior amongst people even now.
Okay, so what you're clearly saying is that, the lockdown may have been eased, but you need to mask and ensure that the COVID appropriate behavior is maintained.
Very true.
Okay, can we get to the questions? We have a few questions that have come in, and there's one question which is very basic, and you spoke about vaccines, and MS, Santa Maria asks, do vaccines really help, or is it just creating herds?
Now, people want to see objective results. You remember when you were a child, you were given a little scar on your left arm,
right?
The BCG vaccine. You never asked this question, why was I given the BCG vaccine? Never questioned the doctor why your child was given the BCG vaccine, because that's something which you came to accept. Now, when we speak about the COVID vaccine, it's happening just before you. We are living in the best times possible. Today, we are actually living in an era when scientists and doctors combined have managed to produce a vaccine against the disease within a year of the pandemic starting. Now, I cannot be more thankful to the community of doctors and scientists who have actually enabled this happening. The reason is that we need to vaccinate each and every person in a room, and until we vaccinate everybody, the chances of getting the infection still persists. Now, so what happens is when you take a vaccine, such as the AstraZeneca vaccine, it offers you protection of about 78% efficacy when given 12 weeks apart. That means of the 5 people who have been given the vaccine, or out of every 100 people who are given the vaccine, 22 may still get the infection. Okay. Now, if I tell you about data coming from America, they were given the Pfizer and the Moderna vaccine. Now, about 100 million people were given the vaccine in the United States, and they saw a breakthrough infection rate of about 10,500. That means of the 100 million, that means 10 crore people who were given the infection, about 10,500 people did get the infection. That means one out of one person in every crore, and so 10 million people, 10 of the 100 million who were given the 10 crore people who were given the infection, 10,000 had the infection. That means 1,000 people for every crore people given the vaccine, or one person in every 10,000 persons may get the infection. The percentage is minuscule. It's very, very small. It does not mean that the other 9,900 people who have received the vaccine will also get the infection. So we should not hesitate. We should not be scared. Now, you asked, are we creating herds? I don't understand what you mean by we are creating herds. So don't take the literal meaning of herd. Herd does not mean that you're turning into a cattle. When we talk about herd means a collection of human beings. So I'll give you a simple example. You take a room of 10 people, and I've said this earlier. You have a room of 10 people. One person is vaccinated amongst the 10, which is the current state in our country. About 10% of the population is vaccinated. Other 9 people are unvaccinated and potentially may get the infection. Suppose one person, the other 9 will also get. Now, the chances of the person who's been vaccinated getting the infection is still about 20%. That means he may still get the infection if he comes in the 20%. But if you have a room of 10 people and you have 8 people vaccinated there, then the chances of the 2 people getting the vaccine and spread of the disease is very, very minuscule, because these 10 of these 10, the 2 may not get the infection. Suppose they do get the infection, he will only spread it to the other person who has not had the infection. And amongst the 8 who have been vaccinated, the chance will be 1 in 5, so 1.6. So you may see an infection only in about 3.5, 4 people. Not all 10 of them. If at all you ever get the infection, it is easier to control infection in the 10 people than amongst all the 10 people in the room. So it's so important that we actually support, promote, and help everybody get vaccinated as soon as possible. I know several large companies and companies which are actually offering vaccines to their employees and their families, and this is a great initiative. I've seen housing societies come together and give vaccines. My own club in Kulaba, the radio club, is giving vaccines to its patrons and to everybody in Kulaba. So if we can have everybody collectively joining hands, then what is the hesitancy to take the vaccine?
Right. Absolutely. Except that one needs to be careful about this case that has happened recently of a housing complex in northwest Mumbai with dubious vaccination. That, of course, one needs to be careful about. We have a question from Mr. K.V. Lakshminarayan, who says he was tested positive on 14th April and he finished his quarantine by April end. What he is asking is the second jab, is the next jab 3 months from April 14th or 3 months after the quarantine?
It should be 3 months after the date you first had fever.
So that's it. 14th April and 3 months after that.
So May, June, July. 14th July is when you should get the vaccine, after 14th July.
Mr. Raghavendra Odial's question is regarding steam inhalation. When I had COVID in April, an eminent allopathic doctor of Mumbai had recommended steam inhalation in addition to symptomatic treatment with medicines. Is there a difference of opinion among the medical fraternity, he asks?
Yes, there is a lot of difference in opinion, and evidence does not suggest that steam inhalation helps. So if you look at evidence-based medicine, there is no evidence for steam inhalation benefiting anybody in treatment of COVID, but it may symptomatically benefit you. So if you have a nasal blockage, when you have nasal blockage, you may take the steam inhalation, and that may help you. But beyond that, it has no help.
Right. We have a question from Mr. Sushil Kumar, who says, I had COVID and tested negative on 28th May. I presume 28th May this year. How long can I presume to be safe from COVID? And what should I look out for post-COVID complications?
You should still have manage and maintain the COVID appropriate behavior forever. You should take your vaccination when you're due for the vaccination. What in the COVID appropriate behavior, that should be sufficient. So mask up, sanitize your hands adequately, and that should be enough to take care of your COVID.
Right. A question from Raj Hirima. Now, it's not exactly COVID related.
You had second part, weakness, right?
That's right. So he asks, how long can I be safe and what should I look out for post-COVID complications?
So post-COVID complications. So it depends upon how bad your course of COVID was. If you had mild or symptomatic course of COVID, there aren't too many complications that you should anticipate. But you should keep an antenna for new onset of symptoms such as breathlessness, a cough, a new fever, sudden headache or weakness of your hands and feet, and chest pain. These may sometimes the other rare complications may include pancreatitis. That means there may be sudden pain in the epigastrium, which is the space between your chest and abdomen in the center. Look for these signs and symptoms for, and if they happen to somebody suddenly, you should meet your doctor immediately.
Right. Thank you. We have a question from Vasant Gandhi from Mumbai. He says, do you advise to have an oxygen concentrator, that is purchase one, and keep it as a backup in case of a third wave?
So even if we have the third wave, I'm not somebody who's going to be, I'm not an alarmist. I am not a fear monger. I will still suggest that you do the basics. There were a lot of patients who did not need hospitalization in the first wave or second wave who landed up in hospitals because of their own fear. What you should do is when you have the first, you contact your doctor. Do not expect your oxygen to fall before the 7th or the 8th day. What you should do is you should check your oxygen 3 to 4 times a day. Space it out well. Do not just sit and check your oxygen. Put your oximeter on your finger for 1 full minute. Check what's the oxygen level at the end of 1 minute. If 97% is normal, 96 is abnormal. Up to 94, we can easily manage a patient at home. If it is below 94, you send the patient to a hospital. If it's below 90%, the patient may need hospital admission in ICU. Now, why you should not buy a concentrator is because who would treat you with the oxygen at home? Again, you can't it's not so simple that, you just put on the concentrator and you get the oxygen and you're treated for COVID. When we give oxygen therapy, there's a lot of data, a lot of science which goes behind it. In fact, giving too much oxygen can sometimes be detrimental to your health. So again, under medical supervision, you may take oxygen, but understand something, oxygen is extremely combustible, and keeping an oxygen concentrator on at home without medical supervision may actually lead to accidents. My suggestion would be, if you want to invest in an oxygen concentrator, then you rather donate it to a hospital and allow the hospital to give you a bed when the need arises.
Right. We have a question from Mr. Abhan Dhondi, who asks, he would like to know whether it's safe or is there a waiting period for an eye surgery with regards to the jab? How long does one have to wait?
I don't think there is a waiting period. Actually, you may wait for about a week after a vaccination, but beyond that, you're safe to undergo a surgery.
Right. We have another question from Mr. Santa Maria. Says, we cover our mouth and nose. What about the eyes and ears? Aren't these organs also exposed to the virus?
So let me start with the ear. The ear does not have a mucosal surface, which does not have a surface from which a virus could be absorbed into your body. But yes, the eye is uncovered. So when we as doctors or paramedical staff in the hospitals go into a COVID ward, we usually put on protective eye goggles. And we tend to protect eyes. So I'm lucky to have been wearing glasses, and they also to an extent help me protect my eyes. And when I am indeed going into a COVID ward, I put on protective goggles over my spectacles. I do mask up, which covers both my nose and my mouth. Now, I wouldn't suggest this for every person because you aren't exposed to that larger concentration of COVID virus, unlike a healthcare worker.
Mm-hmm. All right. We have a question from someone in Rajkot, Ramanand Ahuja. says, hello, doctor. Yesterday, some news channels reported that they found COVID virus in the Sabarmati River. Is it possible that the infection can be spread in water and food?
So, when we were all learning about COVID, when it had just started off the pandemic, we got reports that there was some amount of COVID virus found um, in the feces. Now this is not actually proven right now. We do not know if there is a direct link between spread of the virus in feces and what we don't know is how viable the virus is or how infective the virus is. These viruses are very, very volatile. They get inactivated very easily. They are not very they're not very hardy. So sometimes what happens is you may see that these viruses get inactivated, because they lose their potential to cause an infection. So now when you speak about the COVID virus in Sabarmati River, now I think the news media is losing its credibility right now. At least the mainstream media is losing its credibility. I don't have an answer for this actually.
Uh, Fine. There is a question from Raj Hirimat. He asked, "Can fibrosis be cured?" One of my relatives had COVID, cured, and right now on oxygen support for lung fibrosis for a month. Alternatively, can fibrosis be cured by taking Ayurvedic treatment?
I'm an allopath and I have no idea about Ayurvedic medicines. I do not support or encourage the use of Ayurvedic medicines. That's my disclaimer. When we speak about fibrosis means scarring of the lung, which is irreversible. Now, every viral infection which causes acute respiratory distress syndrome causes a secretion of chemicals called hyaline membrane, which actually create a barrier between the air containing parts of the lung and the blood containing parts of the lung. So the air containing parts of the lung bring fresh oxygen from the outside into your lung, and through the space which is now occupied by the hyaline membrane, initially or earlier, oxygen would go from the air containing parts to the blood containing parts. However, because there's a blockage there is lesser amount of oxygen going from the air containing parts to the blood containing parts. Hence, the fibrosis, the scarring, causes lack of oxygen, which makes a person become oxygen dependent. But over a period of time, we are seeing in COVID especially, there is a significant amount of reversibility observed. A lot of patients are improving over time. So what's important is that we spend more time and rehabilitate. Rehabilitate means give the patients enough lung exercises, lung strengthening exercises, breathing strengthening exercises, chest expansion exercises, and help the lungs heal as much as possible. Now, what is important is to understand that we're not seeing as many, or we do not have enough data yet to see if this lung fibrosis caused by COVID is progressive. If it were progressive, the use of antifibrotic drugs would have been highly recommended. But if we have patients who still have some potential for worsening lung fibrosis, we are taking adequate consents from the patient and then giving them the antifibrotic drugs such as nintedanib and pirfenidone. So this is not a norm. It has to be judged patient to patient. So lung fibrosis, the treatment would be rehabilitation and exercises along with oxygen.
Right. Thank you. We have a question from Mr. Rajan Agrawal, who says, "I'm 66 and I had COVID and I was hospitalized from April 27th to May 10th, 2021. Now more than 4 weeks have passed, but sometimes I feel a shortness of breath while talking and walking. Please suggest what I should do to fully recover with it."
So Mr. Agarwal, I'm sure your doctors have prescribed you adequate medications. I'm sure you are rehabilitating yourself with exercises, lung exercises, chest expansion exercises, along with the other appropriate drugs. Now, it would be difficult for me to comment upon an individual case right now because there could be several other reasons at your age of 66, 67 for to have breathlessness. It could be respiratory or cardiac. We do not know the details of how severe your infection was. What was your level of involvement of the lung? Uh, so several factors have been taken into consideration before embarking upon any conversation regarding an individual's case. And it would be an inappropriate place to discuss this on a public forum.
Right. Thank you. Uh, there's another question which says that my friend had COVID and she has passed out of it, but her D dimer levels are still very high, and she gets frequent headaches. What can she do about it?
So you would have to see a neurologist and get appropriate investigations done to determine why the D dimer is high. You may need to get some investigations to understand why somebody has the fever, or rather the headache. Now, I could list several conditions which may increase the D dimer and still cause a headache in a person who does not have COVID or has never had COVID. But post COVID, there could be several reasons. Now, if I were to discuss certain things, I'll just open a can of worms right now, and I think I should because a lot of patients do ask about these questions, and that is mucormycosis. So, if suppose somebody had severe COVID and had received non-medical grade oxygen, he may or he or she may have developed mucor infection with mucor, the black fungus which you have heard of, and that can be the reason why that person has a headache, or the person may have a chronic sinusitis which may be causing a headache. Now, high D dimers does not mean that it does not always mean that there's a clot, but there could be a clot potentially, and this clot may be the reason for the headache. So again, do not treat the numbers. You have to bring out the clinical history before we decide upon treatment, and that is why human intervention in the form of doctors is so important while diagnosing the disease before you start treating it.
Absolutely. I think that's important. We have two more questions that have come in. One is Katie Daganji, who asks, Doctor, after both my jabs, sorry, my son and I have developed fever for 2 days, but my 75-year-old husband had no reaction. What is the reason for this?
There's no meaning to it because not everybody has to particularly have not everybody is supposed to have fever after a jab. Some people do not develop fever, and that's absolutely okay.
Right. Right. There's a question which has come from Mr. Lakshmi Nayan again. It says, my wife came out of quarantine by April, and after 50 days, she is still weak and continues to lie down. What is the average time for getting back to normalcy?
So there is no normal time or average time. Suppose somebody is very fit, medically fit, and he develops the infection. And if his infection is very mild, this person will recover very quickly. Suppose somebody started off, or somebody is much older and not as physically fit and has had mild infection, he may recover a little slowly. Suppose somebody is very fit but has had severe infection, he may take a long time to recover. And somebody who started off with bad medical history, or somebody who was not physically very fit at the start of infection and has had a severe infection, may have may take forever to heal. And we have lost several patients who have been physically not very fit. So again, when I come back to the general health, it is important that we start taking care of our health. Patients with chronic illnesses such as diabetes should go back to their doctor and make sure that diabetes is rather well controlled. When we can ensure that, what we are going to do is we are going to prevent these severe infections. Suppose somebody has high blood pressure, he should go and seek help from their medical doctors and get their blood pressure in control, identify the cause. Patients with heart diseases should go back and have their heart diseases looked at by their heart doctors, or somebody who has lung condition should go back to their pulmonologist and have their disease checked upon, so that when COVID comes by, you can take care of both your chronic disease and COVID. Patients who have had bad medical history or uncontrolled chronic illnesses tend to have a more severe COVID infection and a course of infection which is far more severe than somebody who is rather fit.
Thank you, doctor. And I think it's the clear message is it is, if I might use the word, survival of the fittest, right? In terms of if you are fit and the likelihood of you getting a long drawn illness and weakness after a COVID attack is much lesser than what somebody would with the past of being unfit. Thank you very much, Dr. Agrawal, for all your time. And we have a few questions that have come in, but they are not COVID related, so I'm not going to ask them here. But thanks once again.
But if you want, I could still take them. I don't mind.
Okay, so I'm going to take one of them, which is from Aditya Kumar, who says, my wife, age 69, suffered bilateral pulmonary tuberculosis in the year 1980 and was treated with a full course of medicine. After treatment, she was declared fully fit. The past few months, she has occasional breathing problem. Doctors treating her say she has crippled left lung. Others say she has asthmatic tendency. Whenever she has problems, Foracort 200 capsule inhaler is given. Also, she has persistent disorders and piles. Does she need any special checkup or treatment, or does she have to live with it?
Now, there are two answers to this. One, she has a chronic medical condition which has caused her one lung to be more severely damaged, but she could still live with whatever lung she has, though with little amount of disability. We should understand that a human body can survive even with 25% lung. Okay.
Right.
So in that case, because she's had a past history of tuberculosis with a damaged lung, it's important that this is never going to heal or never going to go back to being 100% normal. Now, we have to make sure that she does not get the COVID infection, because if she does, a part of her lung may be compromised. Now, we're not starting off with 100%. Suppose you're starting off with, say, 70% lung capacity. If even 20% of the lung is infected, your lung capacities will drop to 50%. Now, that 50% may not be enough for her to live a healthy life while having the COVID infection. Okay, so it is important that we take care of her, we vaccinate her. Now, when you say that, so there was another part to the question. Mr. Maheshwari, could you allude to that?
So basically, she said, I'm sorry, I have deleted the question, but I have deleted the question. But broadly, she was looking at what is the kind of care to be taken given the condition that she had.
You do nothing. So now you spoke about asthmatic tendencies.
Right.
Now, if there is asthma, which is proven to be asthma, now it may not, so she may be breathless, and we should not equate breathlessness with asthma. Asthma is a distinct medical condition which is caused by certain allergies or by certain conditions which cause a spasm of the tubes taking air from your nose to the very corners of your lung. Now, if that is happening, then you should use inhalers, appropriate inhalers as prescribed by a doctor. And what we have actually observed is that patients who are asthmatic, well-controlled asthmatic, are tending to do better with their COVID. They have a milder course of illness if they ever do. In a year and a half, I have not come across a single asthmatic patient of mine who has had severe COVID which required hospitalization with oxygen or an ICU care with a non-invasive ventilator or a ventilator. So remember, the goal is to correct all your illnesses. If you aren't somebody who's healthy, it is the right time to prep yourself up to become healthier. If you have certain medical conditions, get them sorted. If you think you're not medically or physically fit, it is time to start moving and get fitter. That is the only way you prevent severe infection.
Great. Thank you very much, Dr. Agrawal. I know you've stepped out for the weekend, and it was really great that you could spare the time. And thank you once again for that excellent cover story that you've written in Seniors Today magazine. From the feedback that we get, it has been doing very well, and it has virtually viraled across the country. So thank you once again, and to all the people who have attended the session, thank you. And we'll see you once again next Saturday for another session of Health Live at Seniors Today. Thank you, Dr. Agrawal.
Thank you so much.